So I'd like to welcome everybody. Hi, I'm Debbie Plotnick. I'm Vice President for State and Federal Advocacy at Mental Health America. And I am joined today with two terrific ladies. My good buddy, Zahlaway Belsito, out of the Boston area, and my new friend, Amy Stiffarm from Montana. And I'm going to tell you a little bit more about them in a minute. But the first thing I want to do is I want to wish these ladies and all the other moms out there a belated Happy Mother's Day. And I hope everybody had a good day. But for those of us who are moms, of course, every day is Mother's Day. That never changes, because that's one of the most important roles that we have. And we've come together today to talk about the incredible importance of mom's mental health, and that's before the babies come, that's during the pregnancy, and that's after babies are born. It's so important, and moms have some very special needs. Let me tell you a little bit about our guests today, and we're going to be engaging in conversation. So we hope that you will put things in the chat. If you have a question, feel free to type it in and we'll see it and we can answer your questions. I also want to let everybody know that this webinar, along with all of our other Mental Health Monday events for May, will be posted on the MHA website. It's being recorded. It'll be available for download in about a week. So if you or your friends were unable to join us today and you'd like to share the information that you hear, you'll be able to take it right from the website. So I'm going to start by telling you a little bit about Zahlaway and Amy. So Zahlaway is the founding member, the founding person and policy director at the Maternal Mental Health Leadership Alliance. And I always trip on their letters. There's a lot of M's in there, MMHLA.
There's a lot in there, Debbie, you are right.
There's a lot, the Maternal Mental Health Leadership Alliance. And Jamie's the founder, and she's one of the best policy advocates that I have ever encountered. She's very powerful on the Hill, and she's going to tell you some more about some things. Zahlaway is a Boston native, which you'll hear when she speaks, and I teased her because people can always point me out as being a Philadelphian as well. And she's a former commissioner on the Ellen Story Special Commission on Postpartum Depression in Massachusetts, and she's a trustee at her alma mater, which is Salem State University, and a board member of the Massachusetts March of Dimes. So she's got a lot of mom involvement there. She's also the former advocacy chair for the National Coalition for Maternal Mental Health, and she really led an amazing grassroots effort on engaging mothers and families across the entire country to pass the Bringing Postpartum Depression Out of the Shadows Act in 2016. And we had a lot of fun in Washington gathering people and doing congressional briefings and things, but it worked. So the act has been in place since then. And Jamie's a candidate for the United States Congress out of her district in Massachusetts. And her platform, of course, focused on the health and wellness of women and children and families. And she's really committed to keeping maternal mental health a focal point in all of our nation's policy and centering on the communities of need and really helping to get access and funding for all of the important issues around families, moms, kids, and especially mental health. Amy Stiffarm is Ani, and she's of the Fort Belcamp Indian community, and she also descends from the Cree and Blackfeet people of Montana. And Amy's joining us today from her home in Montana. And she also just told me that she's getting her PhD at University of North Dakota, which is very cool. And she'll tell you more about her work in Indigenous women's health issues. She is the mother of two daughters, Tamaya, and let's see if I can get it right this time. Keisha? No, I still haven't gotten it right. Help me out, Amy.
Yeah, yeah, I'll help you out. So her name is Kasaya, and my name is
Oh, yeah,
actually.
I don't know why I can't get it right.
A lot of people can't. We call her Kissy. And I'm actually Amy's Stiffarm, and I'm Aani from Fort Belknap. So it's a lot to take in. So no
Sure.
worries.
It sure is. And Amy is a survivor of maternal depression and anxiety issues. And she's really devoting her education to understanding more about these issues and helping to heal communities. She's been involved in research with tribal communities since her undergraduate days. And she really found her passion for maternal and child health during her MPH, her Master's of Public Health at the University of Montana. And as I mentioned, she's working on pursuing her PhD in Indigenous health through the University of North Dakota. And she, in her spare time, likes to run, and she likes to write, and that helps guide her in her healing journeys. But one of the things that I wanted to start off with today, because I think it's so important that we always talk about why it is that we're here doing what we're doing. When it comes to mental health, as I always say, it's always personal, and it is. So I'm going to ask if you both would share a little bit about your personal journeys that brought you to advocacy on this important issue. Jamie, you want to start and then move to Amy?
Sure, thank you for the opportunity. And I want to again say the partnership that MHA had with the then National Coalition for Maternal Mental Health was instrumental with our other partners in working with Congress in 2016 to finally have acknowledgement at the federal policy level that maternal mental health is something that needs to be addressed. Its prevalency is such that it is the #1 complication of pregnancy, and it is underdiagnosed, underdiscussed, pushed aside, and I myself found that I was part of that. My name's Jamie Zahlaway Belsito. I live in the North Shore of Boston, and I am the mom of 2 wonderful girls, planned pregnancies, traditional marriage, private insurance, you know, all of the niceties of living in the white suburbs of Boston. And I found myself debilitated by anxiety, insomnia. With my second, it was postpartum rage, which I wasn't even aware of existed. And I did experience suicidal ideation with my first, and said to myself, I'm not quite sure what's happening here. I'm usually the first one to pick up the phone and try to get people together and do fun things. And here I am thinking that the best thing I could do after giving birth to my first daughter was no longer be here, that there was no reason or purpose for me, that I was a horrible person, and that the best thing I could do for my family was disappear. And that brought me into all of the wonderful accolades that Debbie read off of who I am. I am a mom. I am a mom, and I am a woman. And there's one thing I've learned most deafeningly as being a mom is women's voices aren't heard. People aren't listening to women. And when I sought support services for what is the #1 complication for all pregnancies and postpartum, I was met with whispers, lack of resources, and medication that I was supposed to manage on my own. And my thoughts were, if I am experiencing this as a white woman in the Boston suburbs that prides itself on having the best access to healthcare in the world, what does that mean for everyone else? It is unacceptable. And so I was able to channel my phoenix rising from the dust into policy, of which I had done before in the capacity of immigration and accessing accessing the American dream here in the United States. And I will not rest until the legacy is that women have access to healthy maternity care, mental health care, and that we look at mothers and children the way that we should, and that the health and wellness of women and the health and wellness of children is the basis of our communities in the health and wellness of this country. So I'm thrilled to be here, and it is based on lived experience, which I think really each and every one of us who have been in that seat know that we can make a difference. One voice can make a difference. So thank you.
Thank you so much, Jamie. Amy, tell us a little bit about what brought you to your studies and to your advocacy around maternal mental health.
Yeah, of course. First thing, I just want to start out by just saying that I'm calling in from the ancestral homelands of the Kasanka, Salish, and Kalispé peoples on the present day Flathead Reservation, located in what is now known as northwestern Montana. And I just want to pay respect and give honor. I'm a guest here on this land and just appreciative to be here and share this space with you guys. So yeah, like you mentioned in my introduction, I am a survivor of maternal mental health issues, and I am enrolled on the Fort Belknap Indian community, and I grew up 3 miles off of the reservation. And I also descend from the Cree and Blackfeet tribes, also here in Montana. And I grew up with all of this culture around me. But I never really had the opportunity to learn very much about traditional practices related to pregnancy or birth or motherhood. And with my second child, I experienced depression and anxiety. And in my healing journey, I've learned a lot of things that really could have been helpful to me in motherhood and in pregnancy, but even before. And so, when University of North Dakota announced that they were doing an Indigenous health program, I was like, wow, it was one of those moments where it really felt like the stars aligned, because I had been really active in like breastfeeding advocacy with my first child. But with my second man, it really hit me. Like I felt like I was stuck like cement, or like a gray feeling where I just, just getting through the day was like plenty. I didn't have the energy to do much else, and which is fine, like that's okay too. Like as moms, we know those phases in our life. But I always thought if I went back to school that I would have to like do a double major or multidisciplinary, make up my own degree, where I would have to do some, native studies and public health. And so I was kind of like thinking about that, had actually looked at a couple degrees, and when Indigenous health was announced, like, man, I was like, oh my gosh, this is it. And so I applied, and, I didn't know we were going to be in a pandemic like this. So it was kind of try not to think about it too much, because it's like, man, what was I thinking starting a PhD? But it's great because a lot of my classmates, we really feel called to this like higher purpose of helping. And I wasn't sure exactly what I wanted to study. I knew it was, I really liked breastfeeding work, and I knew I wanted to do something maternal related. And I've been healing, especially during this pandemic. This pause has really made me reflect a lot. And it was the first day of class, and it was I'll always remember this moment. It was my daughter's 4th birthday, my youngest, Kasaya, the one who I struggled with, with mental health issues. And I remember I was like kind of stressed because I knew I had to decide on what exactly I was going to study. You can't just study like maternal health. And I remember just being like brought to the floor with these feelings of residual shame and guilt of my experience. And of what I had been through and these feelings that I had when I was pregnant and after I had her. And I just literally wept, and I like laid on the ground, tried not to cry too loud to wake him up. And I had this feeling come over me where, you know, I said, why now? Like, why am I feeling this now? Like, I've healed so much. And when I said that, I could hear myself, like an answering to myself, and I could hear myself praying. And I remembered when before even the Indigenous health program was announced, I said a prayer that telling the Creator to open up my heart again, because I was ready to feel joy. And I knew that I had numbed myself enough that I knew that I was just getting through day by day, but I was ready for passion. And I asked to light that fire in me again. And, you know, it was just kind of one of those prayers and something that I didn't remember until I needed to. And I remembered, you know, just comforting myself of that shame and guilt. And I was kind of like on the ground like a baby. And I imagined my mom like holding me as a baby and remembering that she wouldn't want me to feel guilt and shame. And I don't want other moms to feel that guilt or shame. And just trusting that the ancestors are with me and were with my baby. She was sent to me for a reason. I went through that experience for a reason. And I decided that day that this is what I would study, and this is what, you know, sometimes it's painful to look back and think about and see these statistics and these risk factors, but it's healing. And that's really what I want to do, is just help our women, help our moms, especially with the shame and guilt, and just provide healing opportunities.
Amy, thank you so much for sharing that. And generally, I don't talk about my days before folks knew me in mental health. And those of you who do know me through mental health, you know that I talk a lot about adolescent mental health and my experiences with my daughter and her adolescence that was unrelentingly suicidal. And for those of you that haven't heard me say this, and for those of you who have, I say every gray hair says Ashley. And Ashley said I should thank her for two things. One is my distinctive silver mane. People can pick me out in a crowd, even though I'm short. And the other is the direction of my policy career. But before I lived through that, I, like you, Amy, was very involved in breastfeeding education. And I was a La Leche League leader for 10 years. And over that period, I met a number of moms. Not surprisingly, as Jamie points out, the number one complication of pregnancy and birth is postpartum issues around mental health. And I met quite a few moms who had postpartum depression and postpartum psychosis. And very sadly, we lost one of our moms in our group to suicide. So it's an issue that was always important to me. And several years ago, when I had the opportunity to be part of the Mind the Gap Coalition, of which Jamie's organization, and Amy, of course, as a board member as well, as part of, and to be continue that involvement was also very personal and important to me. And as you both point out, we moms are really, you know, incredibly passionate advocates. What we want to do is not leave the rest of the family out, but we really want to be there for them. Jamie, talk a little bit, please, about the kinds of things that have happened over the years, the kinds of advocacy, grassroots, and what it has resulted in, and what we can look forward to right this minute.
I really appreciate the transparency of your journey and Amy's as well. I wanted to actually take a moment as well to acknowledge the land that I'm on, and speaking with Amy and in thinking about the fact that we are all living on native lands. I live in Massachusetts, which is based on the Massachusetts tribe, and it is an Algonquin word that means range of hills. And I am very humbled to have the opportunity to speak alongside a brave warrior mom who's utilizing her mom powers to change the trajectory of the conversations around everything that we've said is to keep these talks to ourselves. And I'll also take a moment to say that the notion of postpartum depression, which is the most utilized term, is not new. I don't know if anyone out here is a fan of the Henry Louis Gates Ancestry show that they show on Channel 2 PBS, but they did a piece on Mimi. She has a son named Ronan who is a writer for the New York Times. I can't think of her name. Mimi Farrow maybe is the name. And she went back to find out that her grandmother had passed away in Australia. She had been put into a mental institution for new moms in Australia and had died from what was termed milk madness. And so this is where we still are. We're still not identifying the fact that there are biochemical changes with the woman's body during the journey of bringing a new life into this world. There are challenges when birthing people miscarry, when we have stillborns, when we're going through infertility treatments, all journeys and all aspects of conception and reproduction. And we need to be very, very honest in saying that this has always been something that has been at the forefront of many people's journeys, but for whatever reasons associated with shame. And it took until 2010 for Lord knows how long this issue's been going on, for our public policy makers at the federal level to acknowledge it. Why? I don't know. Maybe because we had women who had given birth start to be elected into Congress. When you don't have congressional representatives that look like you or experience what you've experienced, you don't address issues. And that would be how we've all gotten here. Whether or not you have a connection with your biological birthing parent, we're here because of somebody birthed us into this earth. And that's the truth of it. So as far as policies go, it was the Melanie Blocker-Stokes Act, which was brought forth by way of Carol Blocker through the loss of her daughter, Melanie Blocker-Stokes, who went repeatedly in the Chicago area. She was an attorney, well accomplished, married, has a 21-year-old daughter living today, could not find the resources to help her, and she took her own life by way of perinatal psychosis. And it took the loss of one's child and the passion of legislator Bobby Rush, who represented that district and is an African-American man and knows the challenges within that part of his constituency, in conjunction with Senator Menendez, whose state of Jersey was the first state to implement postpartum screening by way of their former First Lady, Mary Jo Cody, who had experienced postpartum psychosis. And a part of the ACA actually implemented monies to be put forth to research more on postpartum and address educational initiatives for maternal mental health. But as we all know, there were many people who didn't want the ACA to roll out. And so that initiative lived and died within the ACA and never came to fruition. But that was the Melanie Blocker-Stokes Mothers Act in 2010. Speeded up to 2015, and we had a wonderful new legislator who's new to the block, who's now the Assistant Speaker of the House, Catherine Clark, who worked with doctors here in the Boston area to put forth the most brief of all legislative pieces I've ever seen. Was a piece on postpartum depression, saying it's 1 in 9 at that time based on CDC, 1 in 9 women. It's common, and it doesn't mean you're a bad parent. Words matter. Suffering from a mental health complication during pregnancy does not mean you are a bad parent. It actually means that you're 1 in 5. And to be truthful, if we finally start having people screen and seeing the rates, it's going to end up being 1 in 3. So we're not as special as we thought we are. It's actually very common. And that legislation was wrapped into the 21st Century Cures Act. And what it brought forth was $5 million to be rolled out to states to address another dirty little secret, and I say that tongue in cheek, of substance use comorbidities with mental health. And it gave 7 states, 30 provinces and states applied for this money, and only 7 received it. And it has been a lifesaver for states to be able to educate, enroll in a psychiatric access project. So if you see your general practitioner, pediatrician, you name it, they're able to screen and have support services. We were able to get money. We were able to help pass maternal mortality legislation in 2018 with the Maternal Mortality Review Commissions. We're finding out that suicide combined with substance use and mental health complications are the leading cause for postpartum suicide, why moms are passing away. And we were able to get some monies put in to create a maternal mental health access line across the United States. And that is incredibly important. We have some more to go, but I don't want to take away from pinging the pong to say right now we're talking about women of color, which we've always should have been talking about. Because the reality is, if we aren't listening to white women, we are not listening to anyone else who doesn't look like us. And I'd like to bring that ball back over to Amy to speak about perhaps some things that she thought she has within the Native community.
Yeah, definitely. I mean, first and foremost, I think just the difference in worldviews is important to acknowledge when we're talking about all health, but especially mental health, because there are some very stark differences. And, you know, when we're just kind of accepting Western treatment, it doesn't quite fit in the same space. So for like an Indigenous perspective, we don't really separate mental health and physical health. You know, there's like this well-being, and it's all, everything works in balance. And so when mental, like a mental illness is experienced, it's more often looked at something like you're not in balance in your life aspect. So there's physical, mental, emotional, spiritual, and when you're out of balance, then an illness can show up. And one thing too that's interesting is there's a lot of great Indigenous researchers out there. I just have to say that, because I'm so blessed and lucky that in my program, I'm able to read about a lot of different cultures, a lot of different work that's already been done. Some paths have been paved, some doors are opening, and I just feel so incredibly blessed to be in this space, and just hoping to move this type of work forward. But there was a study where they were interviewing Indigenous elders, and they were talking about this balance, how, you know, when someone becomes off balance. And they also said that mental illness, they don't really see as somebody being mentally ill, like the illness inside of a person, which is oftentimes how Western medicine looks at things. But from an Indigenous perspective, the illness actually lies in the relationships that the person has with these different aspects of life. So it could be within the community, within their family, or within their relationship to earth, all of these different things. The illness is within that relationship. So when you think about healing, we have to think about healing relationships and how important social factors are for Indigenous communities. And so that, I think of that, like being able to understand the difference in worldviews and how important that is to actually bringing out healing in communities. And I think it's also worth noting too that are in the United States because of the colonization of Indigenous communities and the genocide and the removal from land, removal of children, all of these things that have happened to have the United States that we now know. There's a lot of trauma that our communities have experienced. And so when I first started looking up, some facts to put in my papers, and one of the common risk factors for having maternal mental health issues was a past experience of trauma. And our communities have very high rate. I mean, we have historical trauma. We are still very much mourning our loss of land. Land is still being stolen from Indigenous people in the United States. And these things need to be acknowledged, because once we can walk, Dr. Warren, one of my professors, I'm gonna probably butcher it, but he has this amazing quote, like, we have to walk through these truths if we're gonna have equity. We have to acknowledge this history so that we can heal and move forward. And so knowing the high rates of trauma on our reservations, just from historical trauma alone, should be enough information to really try to help. And I think help too is like a little, not necessarily like, come on, come help us, but listen to us. Listen to our tribal communities that you're serving. We need lawmakers and we need organizations to understand that, we're not just full of disparities, we're full of knowledge. We have traditional knowledge. Some of it unfortunately has been lost. Well, I'm trying not to say the word lost, because we don't lose our values and our language and our traditions. They were taken from us. So luckily, not everything, and there is still cultural knowledge, and there are definitely cultural strengths that we have within our communities that have allowed us to live and maintain and continue to start thriving again, many of our communities. So I feel like, when it's not so much about coming and helping us, but listening to our communities, listen to our elders, what kind of healing is already present within our communities, and how can we use that to make better healing opportunities for moms and prevention.
You've both touched on so many important points. We have a couple of questions in the chat, and I'm going to kind of incorporate them into what I'm asking you now. And I really appreciate the talking about the listening, but the listening is only part of it. It's the hearing as well. And how when we hear things, we always hear it through our own cultural lens. So that often reflects the fact that we're not understanding. I'm sure we could all have our experiences with having to take the dreaded cultural competency courses in graduate school. And I always found that term really kind of offensive, as if you could be competent, but what you can learn to have is humility here. And that how bringing that into the listening and paying attention, as Jamie was saying, that women's voices aren't heard. As Amy was saying, you're speaking about it in terms that need to have a little more careful understanding. And also how the equity issues really play into this when it comes to mom's health and mom's mental health and continuing. And we have right now, we have the Black Mothers Momnibus bill that is going to be coming up, and we'll talk more about that on our Hill Day. Jamie can feel free to say a few words about that too. But I want to touch a little bit on, we've talked about some of the Indigenous cultures and how things have been taken away and how there's not that understanding. But the same thing is true, and I know we don't have a Black or brown mom with us today to talk about her experiences, but that's also the kinds of inequities and not listening and not understanding. Jamie, you wanna talk a little bit about that, please?
Sure. And you're absolutely right. I can't speak to the African American or Black or brown space, I do identify as an Arab American, and it's interesting. Last month was Arab American Awareness Month, and I had put out a post of my great-grandmother, whom my daughter Hadia is named after, and she did not speak English. She came here seeking refuge from Damascus, was married at 18, or came here at 16, was married at 18, had 2 children, and her husband died while my grandfather was in utero. Both children were put into orphanages, and she was forced to move and marry another man within her community. And she had a girl, which was not looked at well within the cultural constructs of that community, and the child was taken from her, and she had no recourse whatsoever to fight for herself or advocate for her child. And she was in an incredibly abusive marriage, where even on her divorce decree, of which she sought divorce, it said that the meaning or the causation of the separation of the marriage was extreme physical and emotional cruelty. And I bring this up because even though that's 100 years ago, those stories are exactly the same today. People don't have English as a first language. They don't have recourse. There were cultural constructs within their own family hierarchy, religious hierarchy, whatever hierarchy, and that is a structural racist hierarchy, a culturally prohibitive hierarchy, social determinants hierarchy. And so there does need to be policies to allow individuals to live their lives. And when we take a look at the actual fact of the matter, that maternal health in a country that has the highest expenditures in healthcare in the world, has the highest maternal death outcomes in the world. It is abhorrent and inexcusable, because again, as I said, if I, as a nice North Shore girl, north of Boston, in a traditional marriage, in a home, can't find access to adequate maternal mental health care, then what does that mean for everybody else? And this is why when we take a look at the Black Maternal Health Omnibus, so I'll do a little bit of policy over here. In 2015, this incredible thing happened on the Hill called a Congressional Maternity Care Caucus. 6 years ago, there's 435 members of Congress, and Congress has been enacted for over 2 centuries now. And someone there out in the chat world wants to tell me how long. I can't think of the exact date that we had our first Congress, but it was during George Washington, okay? It took until 2015 for there to be a Congressional Maternity Care Caucus put together to address the health and wellness of mothers in this country. Because generalized you, we started electing women. And some of these women even gave birth while in Congress, which was unheard of. Tammy Duckworth, Kathy McMorridge Rogers, Jamie Herrera Butler. Women were giving birth. And through there, the next iteration, what happened? The more women of color we elected, a Black Maternal Health Care Caucus was formed out of the Black Girls in Women's Brain Trust, headed by Alma Adams and Robin Kelly. And now we have a Black Maternal Health Care Omnibus, which was introduced the last Congress and introduced this Congress again, because we have racial disparities, racial disparities, cultural congruent disparities. We have issues with individuals who are coming in from other countries. We have an anti-immigrant sentiment here in this country. We have a lot of things we need to break down. And going back to what Amy said, acknowledging the fact that we have taken lands away from Indigenous people who have lived here. When I did the research in Massachusetts and the Native population, 12,000 years of indigenous populations before the Mayflower hit the shores here, okay? And we need to call out, and it was said very clearly the other day in the House Oversight Committee on the Black maternal health crisis, we need to acknowledge that there's racism. And it's okay to acknowledge that there's racism. This country was founded on slavery and a whole lot of things that we are actually calling out into light. It's time to move forward. It's time to say we're going to address these and move forward. When it comes to mental health, for the second Congress in a row, we have the Moms Matter Act, which was part of the Black Mommy Bus, which is a 12 pieces of legislation. It's the puzzle piece, 12 pieces of legislation. And the Moms Matter Act is asking for community-based programs to provide mental and behavioral health treatments, which in a moment I'm gonna take my ball and I'm gonna pass it through the Zoom to Debbie or Amy to speak about this, and to grow and diversify the mental and behavioral health care workforce, which is abysmal as it stands right now in 2021 on all fronts. And another thing I do wanna say is we have Deb Haaland, who is now the Secretary of Interior, who left her job in Congress, who was a Native American woman voted into office. And we also have Sharice Davids, who is currently elected into office. And she herself, in conjunction with Senator Tina Smith, put forth the Data to Save Moms Act to address maternal mortality within the tribal maternal mortality review committees, and to conduct a comprehensive review of maternal health data, process and quality measures within those constructs, as well as a comprehensive study on maternal mortality and morbidity among Native pregnant and postpartum people, and also to invest in minority serving institutions such as historically Black colleges and universities, tribal colleges and universities, Hispanic serving institutions, and Asian American and Pacific Islander serving institutions. Because when we delve into those numbers, it is bad for the macro, but when we get into the micro, it is abysmal, and it is not, it's not something that we should accept. But I think that there is a great conversation to be had around resources at the community level.
No question about it, Jamie. We have to really diversify workforce. And when folks tell us what they're looking for at Mental Health America, they tell us they're looking for somebody who's somebody like them and that they feel very comfortable there, or at the very least, somebody who is that good listener who has humility and tries to understand, and what an importance that makes. We have a couple of questions in the chat. And some of them are very general. I'm going to kind of combine them a little bit and talk about how these things have commonalities and how they differ a little bit amongst communities and how they're viewed. So, you know, Jamie touched a little bit on what causes perinatal issues, and some of it has to do with, and Amy touched on it too, some of it has to do with historical trauma, some of it has to do with changes that happen after birth. Some of it has to do with genetic things that happen, all of those kinds of things. And we see them manifest a little bit differently through all cultures. But one of the specific questions that we had is, does it go away without professional help?
So in my experience, and this kind of goes back to some of what me and Jamie had talked about in the policies and expanding into telehealth. Because for me, when I realized something was going on, I actually Facebook messaged my best friend, said, so I'm gonna have to tell you something, don't freak out. I think I have postpartum depression. Like, I was so scared to tell her. And she said, I got you an appointment at IHS, Indian Health Service, for those who don't know. And I said, no way. I am not going there. I don't want to see anybody tribal, because it doesn't make sense now. But then I was so afraid of people. I was afraid of going to IHS and people seeing me and knowing why I was there and all of this. And so luckily for me, she she found a different appointment with a non-native who I didn't know. She didn't know me. And I would go there every week. So when we talk about telehealth, that's something that would help, I think, a lot in tribal communities. And yes, we do want to see people who look like us too, to better understand, because sometimes we feel like we have to leave our culture at the door and just talk about other things. But in order to experience true healing, you have to bring your whole self there. But as far as therapy, I didn't take medication, and everyone is different. But I did learn some really good like body scanning skills and connecting to my breath, skills that I still use today. Another part of my healing journey I talk about is running. And that's just not like the physical activity, go outside and get some cardio. But when I run, that's when I connect to nature. I connect to land. I pray. I am connecting to my ancestors. And so it is different for everybody, what brings healing to them. But that's some of my personal healing.
I will, and I love hearing Amy's story, and I look forward to meeting Amy face to face. You know, it's these connections, right? Amy can be in Montana. Debbie, you can be in your home, and I'm in my home here north of Boston, and yet we're talking about, you know, similarities in humans. And then there's the more granular parts that we need to discuss. Does this happen to everyone in birth? No. And I do have to say, going to the mom groups at the time when you could, and seeing a mom who actually lives here in the town that I live in now, and she's a super mom, and she was like doing things with, you know, the breastfeeding and homemade food and cooking dinner and all these other things, and I couldn't even get out of bed. My point with that is that I needed help. She didn't. And so I needed to reconcile with myself that I was not going to be that mom. And it didn't mean that I didn't love my child. It meant that I needed help. None of it had to do with my baby. It had to do with me. I will say the second time around, I healed on my own through that first journey with talk therapy. The second time around, oh, and I'll put a pin in that. Vitamin D deficiency is a huge issue with us, okay? As my doctor said, you'll end up with rickets, but the child will be fine because it depletes your calcium. It depletes your calcium in your bones, okay? So vitamin D, and being in the Northeast, especially having a baby in the winter where the days are very dark and the nights are very long, you know, there are elements of that aspect to it as well. You can't get out and walk the baby. You've got 6 feet of snow. You're trapped in the home. So there are some parts of this that need to be looked at. Where do I live? Do I have deficiencies? Have your doctor look at those things. But the second time around, when I truly could not manage where I was, we moved. My husband had a new job. I had a toddler and a new baby. I said to myself, I am going to give myself the opportunity to take medication, because if I had an ailment such as diabetes or cancer, I wouldn't think twice about taking a therapeutic to get myself better. And I'm going to give myself the same advice I would to someone else, because you're always nicer to someone else than you are yourself. We're so judgmental of our own individual selves. I did choose to take medication. It didn't work very well, but it opened up the door for me to say it was okay. And that's part of the stigma we need to break down. We need to break that down. And I wanted to also say, I do think that there are preventative measures to this, and I saw Amy put that in the chat. There is approximately, if you go through a traditional system of maternity care, 20 plus times to have this conversation about mental health. And not on a scanned piece of paper that's been scanned 42 times with, you know, 5 different smiley faces on it, and you pick the smiley face, how you feel, happy, sad, or in between. But no, this is normal. This is normal. And we put some resources, or at least MHA will put some resources out there. If you don't feel yourself, you are not alone. And there's a lot of peer support, outreach, and now we're seeing access to telehealth during this time. And I think that knowing that you aren't alone is half the battle.
I think you touched on the most important things. It's the not being alone and the fact that moms are different. All moms are different, and they're entitled to make choices. They're entitled to be heard and to get the kinds of support they need. And Amy has been putting in the chat and talking a lot about prevention. And, you know, Mental Health America, our tagline is before stage 4. We really believe that prevention is so important. And we know that in our so-called traditional families, like Jamie is talking about, where you have mom, you have dad, you have the kids, you're moving to a new community. Where are your moms and your aunts and your grandmothers and your sisters and your support systems and all of these things? That doesn't mean that they have to be blood, but what an important preventative thing it is to have community. And it's been so hard during COVID to have community. At our MHA website, we've really seen a tremendous increase in the number of people who are coming to screen for all kinds of conditions. And that includes our maternal mental health screen. In fact, of the people who come now, yes, it's true, they're a self-selecting population, but that about 80% of them who are coming because moms themselves know, just like any individual at any age knows when something is bothering them. They don't know what it is, but they know they want to check it out. And then where they go from there is really hard. Amy mentioned telehealth. One of the major policy issues that we're working on at Mental Health America National is to keep the expansion of telehealth once the pandemic ends, and what a difference that has made. Would anyone like to talk about the resources and the things that moms can have even in this really difficult time?
One thing too, sorry, that I wanted to add, because you were talking, Debbie, you were talking about culturally congruent care and how you're like, you're so right. Like, you can't be competent in a culture that's not yours in just, you know, a quick training or something. So what we learned about is called cultural safety. And I made sure to write down, because I read a couple articles about it previously, but in one definition I like, part of it is understanding the roles within the power differentials, and showing up, you know, so that your patients can feel safe to be their whole self, to where they don't feel like they have to leave their culture at the door. And part of that support that you talk about, one part of my healing, it's like I look back and it's a little bit, things get a little bit more clear. But one thing that I think was really helpful was my daughter was at an immersion Head Start for the Salish language, and they had parent language classes. And it was just a bunch of women, mostly the teachers and a couple other moms, it just so happened, would show up, and we'd bring our babies, and the teachers would help us with our kids, and we'd learn language, and we'd talk and visit and share culture. And when I think about that time, that was a real shift for me, because I wanted to make it to Friday. You know, like, it was like, oh man, and just by Friday, and just a lot of times, you know, that kind of stopped the scary thoughts, was looking forward to that time connecting with other strong women. And so I think of those types of supports and resources within our own community. I'm helping on a project right now where I get to look at the different reservations here in Montana and look at the assets and resources that are already there. And so this has been done for the regular cities and towns, but when we're looking at tribes, one thing I've got to talk to them about is, okay, well, what about land? Like, let's look at the land. Like, where are some spaces where moms can go and connect safely with their family to land? And the other thing is culture. Where are these cultural resources that people can connect? And so it looks a little bit different, but I think the same kind of knowledge could be applied across the board. But those are some of the resources in our communities.
I'm gonna let Jamie jump in for a minute, but you touched on something that was really important we haven't talked about. You talk about families. So, I mean, we've talked a lot about moms, and moms are one of the best resources for each other, no question about that. But we also have to bring the rest of the families in there and support the rest of the families and educate them. So,
You know, and this is why we're talking about, I'm trying to find the words, because it is such a grave issue. The amount of women that have been displaced in the workforce during this pandemic, the escalation of anxiety for pregnant birthing people during this pandemic, and why, when we're looking at the Black maternal health crisis and the Mombi bus and community resources and telehealth, as well as, you know, state level and community resources, why we're talking about this within the infrastructure package at a policy level within Congress. There was a proclamation made yesterday by the administration saying that we are going to continue to invest in childcare. We're going to continue to invest in our communities. We're going to increase the child care monetary equivalent. I'm flailing with the tax credit for children. We're going to invest back into our communities because, you know, first and foremost, we do not invest in families here in the United States. We expect them to flourish, but we give them nothing to flourish with. We've even been fighting for Medicaid extension. It should just be called expansion, but the terminologies had to be used extension because of a certain group of folks on the Hill that don't want to think of it as it shouldn't even be a discussion. Women, birthing people should be covered their entire pregnancy and up, in my professional opinion, up to 3 years postpartum, but we shouldn't be begging for 12 months of coverage. And part of the mental health piece of this is there's conclusive evidence-based data that mental health complications can rear their ugly heads in 4 to 6 months in the postpartum period. And this affects the family, whatever that construct is, the partner, the other children, the grandparents, whomever that is. This is a family issue. It is a birthing person's issue. It's a mother's issue. And I will use the word mothers. You know, mothers have been overlooked until 2010 in policy. And we will be respectful of the population that doesn't identify with a specific gender, whatnot. The voice of the birthing person has gone unheard, and it affects the family. And I'll tell you who else it affects: the children that don't have their mother anymore. The health and wellness of that child growing up without another parent, because this country hasn't done what it's needed to, or the system hasn't done what it's needed to protect the most vulnerable of all vulnerable people, is egregious and lays within us. But here we are with MHA, and MMHLA, and all other organizations that are working on this to bring this out of the shadows and into the light, out of the shadows and into the light, and talk about the impact, the entire societal impact, the impact on the family, the impact on the child, and the impact on the woman. And the racial inequities around this have created mental health issues, because when you're telling Black women, hey, you have a 3 to 4 times chance to pass away than a white woman, and there's a young mom out there looking at love of their life, you know, wants to have a baby, and you're telling them proactively that based on data that we found in this country, 66% of the maternal mortality numbers were preventable, and you're still at risk. That can be terrifying. No, I want to put it into perspective here. We're talking 700 to 800 women, and from a 800,000 birth, if we're talking data points, that's a very small percentage, but one is too many. One is too many. And nobody should be walking around with fear. And we've also seen that racial trauma is connected to preterm birth, and there's a whole other piece of that. And so, but we all need to be, I'll let each other know that you are the best mom out there, you are the best parent, and there are resources. You are not alone.
Thank you, Jamie. I mean, you're absolutely right. And we've hit on so many important issues. I want to just point out, because we've got to wrap up just about now, that there are some really wonderful state issues happening as well. Jamie talked a lot about the federal issues. We're going to be talking about that more on our Hill Day on Monday in 2 weeks. But there's also a lot of cool state things going on. Jamie mentioned about the extension of Medicaid for moms up to 12 months. It's a step. It's not all we need by any means, but it's a step. But states have to ask for it. So one of the really important advocacy issues right now is to contact your state legislators and tell them all they have to do is ask to make that part of their Medicaid plan, and it will be granted by CMS. That's part of one of the relief packages. It's so important. And please do check out the national resources. We have Jamie's organization's resources. We have resources posted from our friends at 2020moms.org and the Mind the Gap report. And all of these important resources are out there, but it really is for every culture and every family, and every part of the family matters, because moms really matter. So thank you so much, both of you, for joining us to talk about the importance of moms' mental health and how that matters to our communities and our families. It was so good to see you both. Thank you so much. And I have to excuse myself because I have to prep for a webinar I'm doing for another organization. So thank you, Amy, pleasure to meet you. I'm so sorry we didn't get a chance to get more acquainted beforehand. May being Mental Health Month, it is a wonderful thing. It's also sometimes an overwhelming thing. We all have so many things going on for this month, but it's so important. And thank you so much for bringing the Indigenous perspectives about land, about community, about culture. And I know there isn't one perspective, but it really matters to hear some of the touch points that people need to learn to incorporate, not just hear the words, but understand how the individuals speaking them mean them. So thank you again. And my good friend, Jamie, thank you as always.
My pleasure.
Thank you.
You're welcome. I'll look forward to seeing you both as we continue fighting for moms and for good mental health. Take care, everybody. Bye-bye.